Welcome to CARE Conversations with Clarity Financial Solutions, where through education, we move you from confusion to clarity on all topics touching retirement. Join us as we learn and grow from others' experience on entering into the next phase of life with peace of mind and conviction that you have a team of experts to help you, educate you, and let you know your unique retirement is upon you. So it's time to take a deep inhale, a slow exhale, and walk into this next phase of life confident and with clarity. Welcome back. I've got Shantel with me again. Thank goodness. We love having her on the show with us. But welcome, community. And we are so thankful that you want to dive into topics that we think are super interesting. Last episode, we just kind of talked through why we are passionate about understanding Medicare, but we didn't really do any deep dive on truly the nuts and bolts of it. I know I did that in the second episode, but as this is open enrollment, when this is airing, I think it's important for us to take another couple minutes, at least this episode, and kind of help you just do exactly what we said last week, which was the foundational building blocks. Because if you don't understand those, how can you possibly understand what to supplement original Medicare with or forfeit? So I have a PowerPoint to keep us on track. Okay, because we need that. Otherwise, we'll kind of be all over the place. So let me pull these slides up and we will get started. And here we go. So let me make it a little bit bigger, obviously, because I think probably you'd want to see what we're talking about. So there are four. You have to get closer so they can see there. Oh, yeah. Tiny. All right. So there are four original parts of Medicare, right? So what are they?
So A is hospital, B is medical, Part D is prescription drug, and then there's also Part C. That's what everybody's hearing right now is about that Part C. And even the commercials right now almost make you feel like, okay, I've got A, I got B, I got D, I got to elect C. So we're going to kind of clear up some of that today.
That's right. And if you have questions about your specific plan, obviously find someone in your community or reach out to us, engage, and we can go through what applies to you. But let's go to the next slide, which is going to talk through, and I know it's tiny, so you have to zoom up a little bit, but really these are the two paths. Once you have original Medicare A and B, you have the option to elect ways to supplement that which Medicare does not pay. On the right-hand side, we have Medicare Advantage Part C. So you're going to have your A and your B and your D. All of that together equals C.
Yes.
So you no longer have original Medicare. Like we had said last week, you forfeit those rights and options, but you combine them into one card. Okay.
Mm-hmm.
So, and if you're a veteran and you don't need Part D benefits, there are specific plans without Part D benefits. But this is where you're going to see most of the advertising, right? So the Medicare Advantage Part C takes over A, B, and D, or just A and B. And then on the left-hand side,
it is. So we have original Medicare. So we have our hospital is Part A, Part B is our medical. And then Part D is our prescription drug coverage. And then down at the bottom there, you'll see it's called a Medigap, also known as a Medicare supplement. So we still have original Medicare that covers 80%, and that Medigap is going to cover everything else. The gap, like the word, it's literally going to fill in the gap that original Medicare doesn't pay, outside of a small annual deductible. It's like a couple of $100, $240 this year. That changes each year. But I have never had insurance with only a $200 annual deductible.
No, so mine's like thousands.
Yeah, so original Medicare is amazing coverage. But yes, this kind of fills in all the gaps and you have checked all the boxes.
Yeah, and I want to also tell you guys, like, it's important to understand that, you have paid for Medicare. So when you see in the news, and I'm not going to get political, but Medicare for all, who is going to pay for that? Because every single paycheck that you've ever gotten. I remember when my daughter, specifically, my sons did this too, but my daughter was crying, came to me with her first paycheck, and she knew how much she made per hour, and she had calculated in her head how much her paycheck was going to be. But then there were these deductions. FICA was on hers. FICA, yeah, who's FICA? And why are they getting my money? But you have paid into the system, okay, and through your work record, and that's how you pay for Part A. If you didn't work and you're married, you can also get it from a spouse as long as they've had 10 years of work history or 40 quarters, or you can pay for Part A. Okay, so Part A is expensive. It's over $500 just to have it.
That is another misconception. A lot of people take Part A for granted because they're like, oh, I can get A, it's free. And it's like, okay, but you paid for it. And some people, they don't have their work history or their work history. And it's expensive.
Yeah.
So it is very, very valuable.
Very valuable. And then Part B, obviously, we're going to get into how to pay for that. That's based on your income. But I just wanted to bring that up because it's really important to know. So let's go back and keep talking through this. So those are your two options. So you have your foundational building blocks A and B, and then you either you forfeit those and take to Part C, or from any company, doesn't matter. It's just a Part C plan, or you get a Medigap, which truly does just that, fills in the gaps of what original Medicare does not pay.
So I'm going to ask you a question that I got from a client the other day. They say, okay, so if I want to do that Part C plan, and if I'm forfeiting my original Medicare, then I don't have to pay for my Part B, right?
Yeah, you would. No, you got to keep paying for it. Now, some of the plans will give a portion of your Part B back to you, and that's kind of an enticement, I think. I mean, I shouldn't really use that word, I guess, because it is legal, but
just understand if I'm getting something back, what I don't have. But unfortunately, just because we elect in a Part C and our original Medicare goes away, we still have to pay that Part B
and Part A if you're paying for Part A too.
Correct.
So
okay, that's fine. Yeah, I got that question.
So how does Medicare work with private insurance? I think it's really important to understand just that you can still be working, and depending on how many employees that company has, you may still have to get original Medicare or not. It's dependent on which will be primary. Will it be Medicare if it's a small company, or will it be your insurance? But it does work with private insurance depending on that. A lot of people, they're worried about getting penalties because you do get a penalty if you're supposed to sign up for Part B and you don't. And then you wait, and you can't just go on it as soon as you find out that you're supposed to be on it. You actually have to wait, if you miss your window, till the next open enrollment period. And it can be a lot. It's 10%. The penalty if you don't sign up for Part B when you're supposed to is 10% of whatever that Part B is that year. And they tack that on to your Part B, and you pay it every month for the rest of your life.
Yeah.
Yes. Right?
Not fun.
Not fun. So, but it does work with private insurance, and people don't realize, when I worked in home health and hospice, I would get I have Medicare, I'm covered. Yeah, you are, but some of your costs are covered.
Don't understand how.
Yes. So what's your exposure even with insurance? Just because I have an insurance card now doesn't mean I never have to pay for anything, right? So you have to know how they work together. And that's what we do. We spend a lot of time educating people on, if you get an explanation of benefits or a bill that has anything more than this amount, you need to call our office and we need to talk.
Yes, and that happens all the time. So even though we may elect in these great plans, we ensure that all of our clients know how their coverage works, because mistakes happen.
Absolutely.
People make mistakes in billing department, and if something happens outside of the expectation, then they know how to handle it. Call us, give you the reinsurance. Okay, you remember I made this, I chose this plan I'm not supposed to have. Now I'm getting a $3,000 bill. It's like, it's going to be okay.
I had a call. Somebody made a mistake. It's funny that you brought that up. She was irate. She's on Medicaid. Okay. So she has a Medicare Medicaid Advantage plan. And we don't have a lot of people that have that situation, but in her situation, she does. And she got a $4,000 bill. Which, So she like, something's wrong. He was like, here's a mistake. And I like this company. I'm like, it's not the company. It was a billing.
It's a billing issue. So yeah.
So just the fact that give our office a call and we'll get it fixed.
Well, yeah. And then that just brings another layer of peace of mind that, hey, if something goes on in the, in the future that I don't know, I can ask them and they can make sure. And
or you can call the company and spend an hour or two online on hold. You can listen to the music and get an earworm, shall we say. I was on hold yesterday for a client. I don't know, 45 minutes, and I'm still singing the on music and the unknown music. Yeah. All right, so let's go back and we'll go to the next slide, which is just going to talk about what are the out-of-pocket costs, right? So I have Medicare I'm covered, except you do have to pay your Part B premium, right? So is yours going to be the same as mine?
No, not necessarily. It's based on our income.
Oh, it is? Yeah. Based on what? I don't understand.
So if I'm Medicare eligible this year in 2024, they're going to reflect back to 2022. So it's 2 years lagging. So another question that I got is, I got one client that said, okay, I'm just not going to file taxes with my spouse anymore.
That's an easy one. That's a really good idea, but
unfortunately we can't do that. So it is, so if we're joint, it's not just based on, that individual's income. It's your household.
However you file taxes. So 2-year deferral. So 2024 is going to be based on 2022. A lot of our clients do not understand that. And they approach that red line, right? They approach retirement where they're finished and they pay off a house. They use what kind of money? IRA money. And that money lands right on their 1040. Uh-oh. Yeah. Now they're Part B. We call it the Irma Cliff, where you're just like, I didn't know this was going to happen. So we had a client that wanted to pay off her mom's house.
Yeah. Oh yeah.
She had the money in different types of accounts. And we were like, if you do it this way, you're gonna have a $12,000 exposure increase in Part B between you and your husband. If you do it this way, you won't. She's like, well, let's do it the way that I want.
Yes. Well, and it's just wonderful to be able to have those conversations because she got to make an educated decision as opposed to just thinking you're doing something great. You make a decision and then there's a, kind of a ripple effect afterwards. So there are times where we sit with clients and we talk through and we actively make that decision, but we know what to expect coming, in the next year.
And we make note of it. It's not that we don't want it not to ever happen because planning has a purpose.
Correct.
But it's understanding why it's happening to you and what's the benefit and what was the opportunity cost. So Part B, based on income, it could be anything from $0 all the way to over $500, and it's per month per person. Okay.
Yep.
And then it changes every year based on, once again, that 2-year rolling look at your income tax. And unfortunately, guys, a lot of times we do have to do what's called an appeal of your Part B, because if there are situations where your income 2 years ago was much higher, but it was due to a windfall or a life event, and oftentimes we can get that appealed. So reach out if you have any questions on that. The people that I know that pay an elevated Part B, they're okay with it, but they also don't want to pay if they don't have to.
Or pay longer than we have to.
Exactly.
Stay on top of it.
I'm okay with that.
Right.
10 years, just because I forgot to tell them, not a good thing. So let's move on to the other kind of premiums you're going to pay. You're going to pay a Part D premium. Even if you don't take medication, absorb a penalty later, which is your prerogative, right? And then you can also have Medicare Advantage plan cost. So premium or out-of-pocket cost, co-pays, co-insurance, deductibles. So just like it says right there, out-of-pocket cost deductibles, a portion of your doctor bill is not paid by Medicare. And if you don't have a supplement or other type of plan, the rest is on you. So if you think about it, we talked about it 2 episodes ago. Outside of hospitalization, Medicare Part B, right, is you pay 20, Medicare pays 80% after your deductible. So if you don't have a supplement or any other kind of coverage, 20% is the bill.
And 20% sky's the limit. There's no stop loss to that 20%.
Not annually, not lifetime.
No.
So
a pretty big exposure. So just being on original Medicare, even though Medicare is phenomenal, you still have to understand your risk and what you're on the hook.
And 20% of $100, right? No big deal.
Yeah, love it.
But what if it's an infusion? What if it's a knee surgery because I'm really active and I fell on the pickleball court? What if we had a client busted his teeth? Kind of. And that's the thing. I always tell clients, don't just think about illness or a disease. Think about your body. Think about if you're active and you're going to have things that you're going to need physical therapy for and things like that.
Yeah, well, there are two things that we can kind of guarantee in this phase of life. We aren't getting any younger, and at some point in time, we aren't getting any healthier. So, just peace of mind, reassurance goes a long ways.
I know. My parents are very healthy. They're both in their 80s, but literally they plan their week around their doctor visits. Because it's like they're a regular doctor, they're specialists, they're cardiologists, they're this, they're that. So it's not that they're not healthy. They just have some issues that they need to be seen on a regular basis to make sure they can continue to be very healthy. So let's keep going through this. Monthly premiums. This is kind of what we alluded to earlier, but you have your Part A premium, and that demonstrates to you right there the cost, right? 0 if you have 40 quarters of work history, or 10 years is what that equates to. And then if you don't have enough, it's going to be paid for by your money coming out of your Social Security check. If you're not drawing Social Security, you will be billed for Part A, but it can be over $500 if you don't have that work history. Part B, $174.70 in 2024. I promise most likely, I would say 99% it's going to go up. We haven't gotten the official number yet, but it will be soon. And then you have that income adjustment. And then Part D, once again, is also income related. So you will have an adjustment if you have a Part B as well.
Yep. If your B is elevated or reduced, your D will follow.
That's right. So, all right, moving on to the adjustment. What is it? A lot of people ask us, what's it going to be?
Clarity Financial Solutions is a holistic financial planning firm laser focused on the distribution side of financial services. Most of your working life, most likely, you've put your head down, gone to work every day, and saved for your retirement. Now you're reaching the time when you're going to be drawing off of those funds. And believe me, we know saving money and spending money evokes very different emotions. At Clarity Financial Solutions, our team has experience in Medicare planning, Social Security maximization, long-term care planning, tax-efficient Roth conversions, required minimum distribution strategies, retirement cash flow planning, legacy, and charitable giving. These topics stitch together, creating a beautiful tapestry that becomes your unique retirement. Allow us an opportunity to learn about your situation and offer you solutions which will bring clarity to topics touching retirement.
Well, we don't really know until you until you show us your tax return, but this is an example of the grid, right? Mm-hmm. So you have if you look the fourth column over, that is the original, that's the main, initial outside of people on Medicaid or state help. They're going to pay for Part B. And then based on how you file taxes, so your modified adjusted gross income, single or joint, and then you have your brackets, which are not the same as income tax brackets. It would be great if it was the same, right? That would be simple, but it's not. And ladies and gentlemen, $1 can put you over. But yeah, so that's really when we're doing any kind of Roth conversion strategy, paying something off, looking into capital gains with clients and things like that, we want to make sure we are on top of these brackets, and our plan is taking these into consideration because it all dovetails together. And once again, it's not a bad thing if it happens, right? Because if you have an elevated Part B, you make a lot of money. But the difference is you want to plan for it. You want to budget. My clients that have money have it because they budget.
Yeah, and we just want no surprises. We know what, and that's how you're able to make your decision.
That's right.
Because, but yes, and then also in there, so the next column kind of shows the IRMA increases for your B and your D. So, so we may have, we're paying, let's say we just assume we're in the second column, and let's say I'm a joint tax return. So we are between the 206 and the 258. where it says your Part D IRMA increase is $12.90. Let's say I'm on a $15 drug plan. I'm also going to pay an additional $12.90 on my Part D. So, and then the Part B, the base is the $174.70. The IRMA increase is $69.90. And if we're drawing Social Security benefits, they can take your B and your D from Social Security. But if you're, let's say, going on Medicare and deferred, or still working, or deferred your retirement, maybe you're waiting until your full retirement age, whatever your plan is, we help people set up Medicare Easy Pay, all that good stuff. And then,
does Social Security call you and ask if they can take it out of your Social Security check?
no, they just take it, girl.
I had a call and someone said, people are stealing my Social Security. I said, no, actually, because you have an increase in your Part B and D, and the government has the right to take.
They will take it before they.
But they didn't
you
even ask me. So yeah, so it's important. I think that these are really great conversations to have. Some additional out-of-pocket costs that you're going to have if you do not have, once again, a supplement or additional coverage is your Part A deductible, which you can pay up to 5 times a year, $1,632, right? So I would say that when that hits, if you're not planning for it and you're sick and you go back to the hospital multiple times,
you're going to feel that.
That's why we love supplements. It covers that. We love it. Our clients that have Advantage plans, they have a per day rate instead of the deductible. But if you just had the original Medicare, that would be your cost. Part B.
So Part B, the annual deductible is $240.
Whopping dollars.
Yes. So it's amazing. It's amazing. So
work insurance, and they're like $240 a month. And we're like, no.
Well, and a lot of times it's really hard to believe because they've never had health insurance options like this before. So it's a big shift. So understanding where Medicare Advantage plans can be very comfortable to group insurance that we are used to all these years. So understanding that we may pay a little more a month, but reducing that exposure is the difference. So,
and I always say this, right? So the definition of insurance is the transference of risk. And so I'm going to pay a premium to get a benefit, right?
Yeah.
And then the Part D for 2024 is $545. Most likely it's going to go up due to the Inflation Protection Act that we were talking about last episode. But, the deductible only applies to higher tier drugs too. So something important to know.
May not, based on your prescriptions, it may not apply to you. So
co-insurance, right? So once again, you just have Part A and B and you're covered, right? I don't need anything else. No, because Part A, when you go to the hospital, after you pay that deductible, you have a per day rate of $408 a day is what you pay just to be there for 61 days, 61 through 90. And then $816 for days 91 through 150. After 3 consecutive days being admitted in the hospital.
Wait, can we just pause and say that again?
Let's you say it. Because it's really important.
It's very, very important. If you are a Medicare beneficiary, I have original Medicare. I do not know, let's say I go into the hospital, I do not know what the future brings, but I know that I'm on original Medicare. My spouse, my aunt, whoever, if I am going to stay in the hospital, you want to advocate to be admitted that night because we need to be admitted 3 consecutive days for Medicare to pay for skilled nursing, if that is something that you need in the future.
For rehabilitation.
Yeah. So we get calls all the time, my dad was in the hospital for 5 days. I don't understand.
I can't take care of him.
Yeah,
I'm sending him home.
Yeah. And Medicare's not paying. What is, so just really understanding. So the only thing is just remember, if I'm on Medicare and I'm staying the night, please admit me. And they may look at you like, how do you know that? How do you know that? Now there are, people out there that it's supposed to happen at hospitals. But again, mistakes happen, things slip through the cracks, and you just want to ensure.
A lot of people don't even realize that they can stay overnight multiple days and nights and never be admitted. They just assume they are, but they're actually in what's called observation status. And if you're a Medicare beneficiary or your loved one if they're spending the night, advocate to be admitted just in case they need you to nurse to be, and you want Medicare to pay for that, as opposed to you if your loved one can't go home quite yet. And then for days 1 to 20 if you do go to a skilled nursing, absolutely no cost. But days 21 through 100, $204 a day. So if you know what it costs to live at a skilled nursing facility, that's not that bad,
No.
right? You're getting your speech therapy, occupational therapy, doctor visits, nurse visits, all the things. But you're still, having to pay that. But here's the caveat, guys, and this is what we're going to talk about next episode. After day 100, if you can't go home and care for yourself, it's all on you. And where is that money going to come
So
from?
Medicare stops paying. Even my Medicare supplement stops paying.
Mm-hmm.
Everything stops paying.
Yeah, because what is your supplement if Medicare stops?
Correct.
Part B is 20%. We talked about that just a little bit ago. 20% of what Medicare approves is what you're responsible for if you don't have any type of additional coverage, meaning I don't have a Medigap, I don't have an Advantage plan. And let's go to the next slide. So the drug, this is, and I'm just going to tell you guys, get ready, buckle up, because it is wild, wild west, right? So we're in open enrollment, Medicare open enrollment, or annual enrollment, and to be precise. And due to the Inflation Protection Act, there are some reductions in reimbursements to plans. And as a result, everything has gone up in the air. We don't know. We as insurance brokers and financial advisors study every single year. We have to pass a test called AHIP.
Mm-hmm.
We have to make a 90 or above, and we only have 3 chances to make that. Then every single carrier we represent, we take a test. We normally have the plans as professionals. We normally have them in August, right?
Yeah, preliminary.
We don't have, as of September, we did not have the new plans. Because they're still being developed. They're trying to figure it out. And just like I said, this year you can pay up to $8,000 in out-of-pocket costs for prescription medications. Not many people do, but you can. Next year, 2025, it's going down to $2,000. So where's the money going to come from? These insurance companies are for profit, and it is going to be an interesting.
It's going to be a big change. It's going to be important. If you have a prescription drug plan, please get it reviewed, because you can have the same medications at the same pharmacy, go in December, get them filled, and then January
they're off the formulary.
Completely different story. So you just don't want to be blindsided, or just simply don't want to overpay. So please get them reviewed.
Yes. All right, so let's go on to this next slide and just talking about what Medicare covers, because guess what? The next topic is long-term care. So when Medicare stops, right, long-term care starts. Medicare covers acute healthcare needs and prevention. So it's going to cover your hospitalization 100% of the first, 60 days. And it's also going to cover medical services, so doctor visits, outpatient services, and 80% of the Medicare approved amount, right? Some preventative service, flu shots, shingles, things like that. So new things have changed, but it does not cover extended care or long-term care. And I don't mean you're sitting in a nursing home and you can't do anything for yourself. I'm just saying if you need assistance with activities of daily living, and it's related to a health condition, Medicare does not cover those assistance unless it's after a hospitalization or you have an injury and you have home health care coming in. But it's not going to be every hour all the time. And a lot of times people just don't understand that. So the differentiation between acute health care needs and prevention versus extended care to make you have that high quality of life, Medicare doesn't pay for that. So it's important to know. So let's go into what other things Medicare doesn't cover. I just told you long-term care. What other things can you think of?
So care outside of the U.S.
A lot of my clients, they travel, don't they?
Yeah, they do. They travel. Dental and vision. So what do we say? Medicare doesn't care if we eat, see, or chew. And it's that preventative stuff. So obviously if there's something that's medical deeming, with the organ of the eye, that is covered under medical. But our dental cleanings, x-rays, root canals, all that stuff is not covered.
All the fun stuff
All the fun things, yes. Hearing aids, unfortunately, are not covered either. Cosmetic surgery, I don't know why not. There's other things as, acupuncture, other alternative care, but amounts over Medicare approved amount. So you want to kind of explain what that means?
Sure. So Medicare has a reimbursement rate for every single diagnostic code. And if your physician charges more than that and they have told you that they're going to charge more than that, then you're on the hook for the additional cost.
Yes. And then the other amounts not covered by your deductibles and co-insurance. So that 20%.
That's right. So that is going to we're running out of time on this episode. And I just, whereas about Medicare, it's kind of ridiculous. But a lot of our clients are more concerned about their health care than they are about their required minimum distribution strategy or legacy planning or anything else. So that's why we love to just make sure our clients have the best plan they need. They know that serves them best for their specific needs, that they know why they have that plan, and they understand when they get these crazy phone calls and other things that it does,
what applies to them, what doesn't apply to them, what to expect.
Yeah. So next episode, we're going to talk about, Medicare stops covering now what? Long-term care. If I don't have that in place, what happens? If I do have that in place, what happens? And we're also going to go through kind of some long-term care changes that have happened and made it a lot more palatable in a financial plan than back in the day.
Yeah.
So stay tuned.
And a lot of things, the long-term care word is so ugly, like Amanda said. We like to think of it as an extended care. And long-term care is not a place. It's an event. It's usually a life-changing event that not only can impact us financially, but how is it going to impact you and your family? Heaven forbid if something were to happen. We can't just assume that my daughter, my son, whatever situation that they're just gonna talk through those things. So
start the conversation.
Yeah. So we are in a long-term care crisis. So it's super important. That's why we're super passionate about it as well. And just educating yourself what's available out there now for you to make changes are not the same choices that maybe your parents had, because some people have been burnt by some of these long-term care policies that they've gotten
still today
or still have. Yes. So yeah.
All right. Next week, look forward to seeing everybody there. Please reach out to us, engage, and help us help you bring clarity to the testing environment. Have a great rest of the day.
Bye.
Join our Clarity Financial Solutions family, where through education and others' experience, we empower you to make retirement choices with confidence. Follow us on Instagram or Facebook, or head on over to our website and sign up for our newsletter. If you'd like to further engage with us, please don't hesitate. Just reach out, 864-987-8729. See you next time on Care Conversations with Clarity.